but we are going to get started. And I wanted to thank everybody for taking the time out in Nova Scotia anyway on this beautiful day. I understand it's raining in Newfoundland. I don't know what the weather is like in Ontario, Mark, but here in Nova Scotia, it's sunny and about 30, 31 degrees. So I appreciate everyone taking the time to jump on this call today with Mark. I'm Marcus Jameson. I'm the MentorAbility Regional Atlantic Coordinator for Nova Scotia and New Brunswick, and Ashley Hammond is my co-host from Newfoundland, and she's the MentorAbility Atlantic Regional Coordinator for Newfoundland and PEI. And we're just really excited to hear Mark speak today and how we can the business case for real inclusion. So just quickly, for some people who are new to the call, MentorAbility is a national supported employment initiative that provides opportunities and education awareness to be shared between employers and people experiencing disabilities across Canada. Ashley and I are the regional coordinators for Atlantic Canada, and with all of you on the call today, we look forward to collaborating with you in the future. So before we get rolling, just a couple of housekeeping. Feel free to ask questions. There's a Q&A box. You can use that. Or if you would like to ask by using your mic, just let us know. We'll turn it on for you. And we will keep an eye on any questions that come up and bring them forward to Mark. And at the end, we'll have a Q&A too. So if you have a question you'd like to ask at the end, just wait till then, and Mark will have some time to do that as well. If you have any technical issues, which is bound to happen, we're learning something new every single session. So if something comes up, just let us know in the chat box, and Ashley and I will do the best we can to help you out. So let's get going. Mark is a disability rights activist up until recently. I guess he's been retired. I guess, Mark, you've been retired for a few years, but he was the owner of 6 highly successful Tim Hortons in Toronto. During those 25 business years, he employed over 200 workers with disabilities in areas of operation, including senior management. At any given time, approximately 17% of his workforce identified as having a disability. Mark is an internationally recognized expert on the economics of inclusion. He's an advisor to governments around the world and is responsible for Canada's National Disability Employment Strategy. Mark's received many awards in recognition for his work, most notably from Her Majesty Queen Elizabeth II. He was inducted into the Canadian Disability Hall of Fame in 2014. He is a prolific connector of people. Mark has raised over $40 million in the nonprofit sector, and he is also a motorsports enthusiast. If you get him talking about race cars, better sit back. It's going to be a while. So, Mark, we're really excited to have you, and enough from me, and over to you.
Well, thank you very much, Marcus. My first question to you is, what's the definition of retired? Because I'm busier now than I ever was before.
Right. We won't let you retire. We keep you busy.
So it's wonderful to be with you today. I'm talking to you today from South Georgian Bay, which is about 2 hours north of the center of the universe, also known as Toronto. And it is a beautiful 30-degree sunny day. And this is my new office that you see me sitting in today. And the cool thing about this office is it's just upstairs from the liquor store. So I don't have to go too far to get a beverage. So what I want to talk to you about today is jobs. And we're in an extraordinary time with the pandemic, with social justice. We're in a time where we don't know what the future looks like. Probably it's a once in a lifetime situation that we find ourselves in today. The pandemic has brought to the surface extreme discrimination against the disabled. You've all heard the stories about eugenics, about people who contract COVID in a wheelchair or have other types of disabilities, gone to hospitals and have been refused care or have been sent to long-term care units where they passed away. And so that's an extreme case of discrimination. But we also have other levels of discrimination against the disabled as a result of the pandemic, including government failures, particularly around finance. Every demographic in Canada was looked after by the federal government, including seniors. They got a stipend of $300. But it wasn't until this week that the disabled community or the disability community were given an opportunity to receive financial help. And that's a disgrace. The disabled are often the last to be considered, and therefore we can't rely on government. We can't rely on government funding. So therefore, now more than ever, getting a job is important. What we're talking about here are real jobs for real pay. And for many of you who are on this webinar, for all of us who are on this webinar, at some point in your lives, you're trying to find a job. You graduate from school, or you let go, you get fired, and you're looking for another job. And you remember the frustration you felt. It took a week, 2 weeks, 3 weeks, but eventually it happened. Eventually you got the job. The frustration level was high. Now imagine the frustration level if you also have a disability and you're looking for that job. In particular, that first job. Many times more difficult. Now myself, as a deaf person, I was born deaf. My experience was a little bit different because I have an Irish background, so I'm quite used to using the blarney. So I didn't have difficulty getting a job. I had difficulty keeping a job. I was a Dickie D ice cream salesman. I was a paper route. I had a number of jobs in grocery stores. And I lost every job because I was deaf, usually within the first week. And I would go home and complain to my mother, and she said, keep trying. And then one day I got a job working in a garage, changing oil on cars. And I made a colossal mistake because I didn't hear an instruction. And so I was fired by lunchtime. And I said to the boss, so you're firing me because I'm deaf? And he said, no, I'm firing you because you're an idiot. Well, man, I was so excited. I ran home to tell my mom that I got fired again, but this time not because I'm deaf, but because I'm an idiot. And my mother said to me, that's great work, son. Keep it up. Yes, it's funny. It was frustrating for me at the time. But most people who have a disability don't have that gift of the gab that I had to be able to get myself into a job. And then, of course, my disability at first was invisible, which made it easier for someone to hire me. If I'd been in a wheelchair, or if I'd been blind, or if I'd been autistic, I wouldn't have gotten a job in the first place. So what we're looking at here is real jobs for real pay. 24% of Canadians have a disability. That's the entire population of British Columbia, Alberta, Saskatchewan, and Manitoba as a percentage of the population of Canada. Now, according to StatsCan, 50 to 54% of those individuals are not working. So imagine that in a country as rich as Canada, 54% of people with disabilities are not working only because they have a disability. But we know that that number is quite conservative. In Canada today, there's about 550,000 graduates from the last 5 years with disabilities who've never worked a single day. And of those, 270,000 have a post-secondary education, never worked a single day. In Canada, if you've never worked a single day and haven't contributed to income tax and haven't contributed to CPP, you can't be included in unemployment numbers. So it's widely believed anecdotally that the real unemployment rate for people with disabilities in Canada is around 70%. If you're deaf, that number rises to 85%. And if you have autism, that number rises to 88%. And why is this? It's because employers, hiring managers, HR departments, CEOs, are all buying into a series of myths and misperceptions that if they hire somebody with a disability, they're going to require more supervision. They're going to work in a less safe manner. They're going to be less innovative, less productive. There's a whole host of negative stereotypes against people with disabilities coming into the workplace. Right? And if you take a look at the unemployment numbers today of 70%, and compare that to the Great Depression of the 1930s, the highest the unemployment rate went to in Canada at that time was 24%, and was considered at the time a national tragedy. Yet here we are, people with disabilities in 2020, and it's a perpetual depression. Why is that? It's because the employers are still buying into those perceptions and misperceptions. In 2020, we talked about this in 2010, we talked about this in 2000. Very little has changed. Everybody's still buying into those misperceptions, although there are some changes being made. It is therefore understood that the greatest barrier a person with a disability faces in order to get into the workplace is attitude. The attitude of employers, the attitude of society towards people with disabilities. Attitude. I'm going to tell you one of my favorite stories about attitude. I fly a lot. At least I did before the pandemic. And I fly mostly with Air Canada. Now, Air Canada has been very good to me. And Air Canada, in fact, is my favorite airline. And I'm sure you don't hear that very often about Air Canada. But Air Canada has been good to me, and here's why. When I book a flight, I book it online. I check off all the boxes, and I come to a box that says, do you have a disability? And so I tick it off. And as soon as I tick it off, there's a whole bunch of drop boxes that come down. Wheelchair user, deaf, blind, user of a service animal, and of course, supporter of the Toronto Maple Leafs. But I check off 2 boxes. And what happens is that the system is flagged. It shows on my boarding pass that the passenger is deaf, but more importantly, the system is flagged that someone who's flying that day is someone who has a disability and might require a little bit of help. And the only thing I need is pre-boarding. Doesn't cost them anything. And what do they get out of it? They get a customer for life. Right? And so I don't hear the instructions. I don't hear the fact that they've changed the gate and I'm getting on the wrong plane. That doesn't happen because they look after me when I get to the gate. Great attitude. But I don't always get to fly in Air Canada. And a couple of years ago, I was in Germany, and I had to fly from Dusseldorf to Heathrow Airport in London, England. And the night before, I booked my flight. And there's that box. Do you have a disability? So I kicked it off. No drop boxes. So how did they know what kind of disability is going to show up the next day? They don't. So the next morning, I showed up at the Dusseldorf airport, and the lady at the check-in terminal, and the nice lady says to me, "Oh, Mr. Wafer, we've been waiting for you. Here's your wheelchair." Yeah. So I said to her, "Well, since last night I've had a miraculous recovery, but now I can't hear anything." She didn't think it was funny. But look at the attitude. the attitude of that airline, and this is a national, huge carrier that travels around the world. When we think about how far they have to go just to get to the level of where Air Canada is, it's all about attitude. Now, I want to take you to my workplace, my former workplace. We had 14 Tim Hortons in 25 years. Well over 200 of our employees had disabilities. This was every kind of disability, from intellectual disabilities, deaf, blind, wheelchair users, people who have missing limbs, significant mental health disabilities, and various levels of spectrum too. So we had people who had intellectual disabilities who were considered quite challenged. All of them worked in real jobs for real competitive pay. We did not create a single job for any of those workers. So what happened in our company when we included all of these people with disabilities? Usually with around 40 to 45 of our 250 employees having a disability at any given time. The first thing we look at is absenteeism. And everything I tell you about this, all this data I give you, cannot be argued against. This is real data, it's empirical, it's evidence-based. So the first one is absenteeism. So the absenteeism rate for my 45 employees who have a disability was 85% lower than my 200 who didn't have a disability. That's a very, very significant savings to any company, since absenteeism is a very expensive part of doing business. It's not just us. Some of the other companies around the world that have hired people with disabilities in capacity-driven ways, such as DuPont in the States. DuPont is a large automotive paint manufacturer. They found an 86% lower absenteeism rate with their workers who had a disability. Again, massive, massive savings to the corporation. The second is safety. Safety is enhanced by people who follow the rules. We take a person like myself who is deaf. I can't walk out of this office and walk across the street without looking. I cannot hear a car coming, I cannot hear a bus coming. So I have to be aware of my surroundings. Some of you on this webinar, you take a chance because you don't hear anything coming. You know there's no car, you know there's no bus coming. And that's how accidents happen. If you have an employee who has cerebral palsy and uses a wheelchair, they are not going to get out of that wheelchair and climb up on a rickety chair or a rickety table to get something off the top shelf. No, they're going to get one of you guys to do that. And again, that's how accidents happen. But those are anecdotal. But here's the proof. In 25 years of operating 14 restaurants with over 200 employees with a disability, we never filled out a workplace injury form ever for an employee with a disability. I wish I could say that about the rest of the staff. And it's an important point because that increased my safety rating to the highest possible level for the quick service restaurant industry the sector that we were operating in. We also talk about innovation. Let's take this same person, the person in a wheelchair who had cerebral palsy. They get up in the morning, take a shower, get dressed, make breakfast, get in the elevator, go down into the parking garage, get into a car, drive to work, quite often with hand controls. They're doing everything in that morning, they are doing completely differently to you and me. Different problem solving skills. And when you come into the workplace, you do not create innovation by hiring strictly brilliant people. You do so by hiring regular people, normal people who have different problem solving skills, because those problem solving skills then float into the workforce as they become part of the team. So by hiring 17% of my workforce, people with disabilities, I had a more innovative workforce. The big savings for us when it comes to the business case is employee turnover. Now, employee turnover in a quick service restaurant business, which is the Tim Hortons, the McDonald's, the A&Ws, the Harveys, is somewhere around 100% per year. So, and that's only for a well-run operation. So it can be 100 to 125%. That means I've hired every one of you on this webinar today, and in next year, you're all gone, and it's 48 new faces. That's expensive. In the last 11 years that we're in business, our turnover rate was under 40%. If you think about this in dollars and cents, and the only difference between our operation and our friends down the street who also own Tim Hortons is that we're an inclusive employer and they are not. We have a 40% turnover rate. They have a 100% turnover rate typically. But if you take a look at the cost of that, hiring one person for an entry-level position in a QSR restaurant costs $4,000 because you've got procurement, you've got interviewing of new employees, you've got to interview 25 to get one good person, you've got your management time, you've got your training. You know, there's probably about 30 hours of online training before an employee even picks up a coffee pot. And you've got the lost productivity of someone who's new versus someone who's worked for you for a while. And so you can imagine the business case is pretty clear. If you just pick that one, which is employee turnover, I'm taking more money to the bank. And that's exactly the message we have to get through. Employers only understand that message. Yeah. We are starting to see increased participation of people with disabilities in the workplace up until the beginning of COVID. Agencies such as Marcus's agency are doing spectacular work and having great success. An organization that I'm involved with, the Canadian Hearing Society, has found jobs for 44 people this year. And the majority of that time was in COVID. And so there's some remarkable work being done. There are a number of reasons why participation numbers are improving. However, there's two in particular that have helped us to move this needle. The first is that employers today are far more comfortable including workers with disabilities in meaningful and competitively paid jobs. But a decade ago, 2010, this was not the case. Employers, in fact, struggled to even discuss the topic of inclusion. It was too far outside their comfort zone. The second is that agencies and service sector nonprofits who find work for the disabled have changed their approach to the private sectors. 10 years ago, an agency would typically discuss the value of employment in regards to the individual. Yet employers did not care. When the discussion shifted and was centered around the business itself, employers began to listen and understand. There is a continental divide between the world of business and the service sector. as neither listen to each other, and as I've discovered over the years, the two are actually frightened of each other. The bottom line, however, is that business holds the courage. Therefore, the discussion of inclusion must be approached through highlighting the benefits to the employer. As more agencies take a business-first approach to inclusion, more doors are opening. In Ontario, we're seeing individuals with intellectual disabilities entering high-paying union positions in manufacturing for the first time. The business case is clear. It is working. It can't be argued against. The data is fact. It's empirical, and it's evidence-based. I want to talk a little about the first person I hired with a disability. And they were going back to the early 90s. My wife and I opened our first Tim Hortons. It was an existing location. It had been open for 2 years. And the gentleman who owned the store was moving on to buy a different kind of restaurant. And he took all his staff with him. So here I am. It was a Monday morning, all new staff in a busy Tim Hortons with a clientele who had 2 years of expectations. And here I am, 33 years old. I have no idea what the hell I'm doing. It was a disaster. By the end of the afternoon, the dining room was a mess, the kitchen was a mess, the dishes had piled up, and I realized I had a need. I had to hire somebody to look after the dining room, somebody to look after the dishwasher. And so I put an ad on the door, dining room attendant needed. And the person who came through the door, very eager to take a job, was a young man by the name of Clint Sparling. Clint has Down syndrome. Now, I didn't have a lot of experience being around people with intellectual disabilities at the time. But one thing I did know is that Clint, if he was going to walk down the street cold calling, he didn't have a chance of getting a job. I knew the barriers that I faced growing up as a deaf person. I knew that it was going to be doubly difficult. And remember, this was the early 90s when things were quite different than what they are today. So I decided to give Clint a chance. Now, as you can imagine, starting a business like a Tim Hortons, you're working 24 hours a day, 7 days a week. And I didn't have the time to help Clint in his training. So I enlisted the help of a local agency. In this case, it was Community Live in Toronto. And they provided us with job coaches to train Clint. And this is a service that's free of charge. It's free of charge all across the country, including in Nova Scotia. These job coaches had to teach Clint how to take a bus. So you can imagine in the city of Toronto, we have hundreds of buses. They all look the same. He didn't understand the numbers or the routes. And so we had to train him how to do that. And of course, that took time. But after a couple of weeks, Clint came on board. We had no more trouble with the dining room. Kitchen looked great. And I recognized that Clint had become my best employee. He was early to work. And I couldn't get him to take a break. And at the end of the day, I could never get him to go home. The job meant that much to him. My staff were not allowed to wear their uniform to work because the uniform would become contaminated by the subway or by being on the bus and being around crowds. And then working with food, it's not a great idea. So employees carry their uniform to work and change at work. But I had to make an exception for Clint because he wanted everybody on the bus to know that he worked at Tim Hortons. He was so proud of that uniform. On his first Christmas vacation, Clint went off for a couple of weeks. And on Christmas Day, he went to his aunt's house and it was a big family. And I had a big family photograph taken. And he shows me the photo after Christmas. There he is in the back of the picture, wearing his Tim Hortons uniform on Christmas Day. And where in the world you get that kind of loyalty from an employee? Quite clearly, Clint had become my best employee. We grew very quickly. We had 5 restaurants in 5 years. And as we grew, I added more and more people who had intellectual disabilities, who had autism. And over the early years, I started to notice a pattern. These people did not cut corners. You showed them how to do the job. There's only one way to do the job, the way that they were told how to do it. They're not looking at the clock to see when there's the next smoke break. They're not running out the door the minute that the clock hits 3 o'clock. They require no supervision. Supervisors were only for everybody else. And their productivity was higher because they had no turnover. I noticed that there was a business case. And so I wanted to prove this. So around the mid-90s, my wife and I decided to open our doors to anyone who has a disability, any type of disability, under conditions that they could do the job or they could be trained to do the job. And over the years, we have hired people with every single type of disability in every position of the business, including senior management. In fact, my director of operations, the top person in my company, had a disability. She is now a Tim Hortons owner. She has 2 stores in the town of Coburg in Ontario. Some employers will question specific aspects of the business case. I mean, the one that I get the most from business owners is based on the productivity, because every business is competitive and every business has to have a certain level of productivity to survive. And so they have this mental block that if they hire people who have a disability, that somehow their productivity is going to go down. It won't. Let me tell you the story of Brianna. It goes back quite a few years, probably around 2011. And I was doing a presentation to an organization, I don't even remember who it was. And afterwards, this young lady came up to me, Brianna. She was around 26, 27 years old and profoundly deaf. And she says to me, I want to come work in one of your stores. And I said, this is good timing, Brianna, because we had just renovated the store and we put in a new system, what we call tandem teams. And that's where we have 2 people working on a cash register. One takes the order and the other one fills the order. The person who's filling the order is not even listening to the customer. They're looking at a computer screen because the information goes from the cash register to a computer screen instantly. So I said to her, this might be a job that you can do. You don't need to have hearing to be able to do the job. I said, are you interested? She said, I'd love to do the job. Now, one of the things that's important is that I do not create jobs where jobs don't exist. I do not create hours where hours don't exist. So I said to her, a tandem team only operates from 7 a.m. to 10 a.m. Monday to Friday. So it's only 3 hours a day, 5 days a week. She said, I'll take it. So I asked her for her resume. And front page of her resume, she had graduated 3 years before from Queen's University with a master's degree. Never worked a single day. In the city of Toronto, on an MBA. Unbelievable. She'd had hundreds of interviews and she had not gotten a job only because she's deaf. So she came to work with us. The only change I had to make, accommodation, was a small card that I put on top of one of the machines, and it says, "Hi, my name's Brianna. I'm deaf. Please look at me when speaking." That's it. She worked with us for a couple of months as a tandem team operator. Everything was going very well indeed. In fact, I found that lineups in front of Brianna's cashier were longer, and people would wait until they could get to Brianna because they wanted to be served by Brianna. She was already an asset to my business. But one of the things I discovered is that Brianna was traveling 5 hours a day to work 3 hours. That's how desperate she was. She had to get from one side of the city to the other. And in Toronto, that's not easy when you take public transit. One day, we had an internal posting for a baker. Now, a baker in a Tim Hortons is a semi-professional. There is a certain amount of skill involved in it. And she said she wanted to apply. Now, the ovens in a Tim Hortons operate on audible warnings. And she's deaf. So I have always practiced ATP, ask the person. It's very easy for an employer to judge and say, well, I can't have her bake because you burned the product. She won't hear the bells and whistles going off. So I said to her, Brianna, go in the kitchen, take an hour, you figure out how you're going to do this job and come back and get me. She's back in 15 seconds. She says, what are these warnings for? These audible warnings that I don't hear. He said, what are they for? I said, well, when the product is ready, the buzzers go off, you take the product out of the oven. And then she says, well, there's timers on the oven too. What are they for? I said, well, when the timers get to 0, time to take the product out of the oven. So she says, oh, I get it. The buzzers are for lazy bakers. And so she was right. And she got the job. And she did a great job. The person she replaced had been there for 9 years. One of the things I noticed after a couple of months of Brianna working is that the amount of product being baked had increased. And in a Tim Hortons, we don't bake product for it to sit on a shelf. You only bake it if it's going to sell. We have systems in place to tell us how much we should bake and when. So that meant if she was baking more, we were selling more. So I did an analysis of her work. And her productivity rate, picture this, I have 27 bakers in my business at the time. Her productivity rate was 18.4% higher than the next best baker of the 27 bakers in my business. So by hiring someone who has a very profound disability, I made more money. Again, the business case. The good news for Brianna is that she is now using her MBA, earning a 6-figure income and working in one of the big organizations in downtown Toronto. We were able to use our connections to help her find a job there. And she's been there now for about 4 or 5 years. A huge success story for her, but a huge success story for us too. To teach us once again that by hiring people with disabilities, we made more money. We had higher productivity. Right? I don't know how many times I have to say it. If you're not doing it, you're certainly missing out. There are so many stories I can give you and share with you about how people with disabilities have changed my business for the better. But Marcus said I only had 5 hours here today, so I'll have to cut it down a little bit. But I'll leave you with one more story before I come back to Clint. And that is how someone who had a very profound disability was able to make a significant change to one of my restaurants. A young man by the name of Adrian. Adrian is on the autism spectrum, considered to be particularly low on the spectrum. When he came to work for us, he started working with us around 2012. He did not speak. He didn't look at you. No eye contact. If you spoke to him, he did not reply. His training went well. He was a perfectionist in the job he was doing, which was very similar to what Clint was doing, looking after the dining room in a big store. This was a Wendy's and a Tim Hortons combined. So he had an easily 6,000 or 7,000 square feet of dining room to look after. Adrian was so proud of his job and his uniform that he used to come to work with his uniform pressed, his pants were ironed, his shirt was military crisp. He would spend 10 minutes putting on his hairnet so it was perfect on his head, put his visor on, his belt was perfect, his shoes were shined. He looked great. He was a poster boy for the way a Tim Hortons employee should look. Now, in that particular store, I had a bunch of 16 and 17-year-old boys working. You can imagine what they looked like when they came to work. Some of them were actually able to sweep the floor with the ass of their pants while they were doing other tasks, or at least they were multitasking. But they'd forget their belt. They'd have their visor on sideways. The shirts were crumpled up in a bag and they put it on. They'd forget to clean them. And it didn't matter how many times they were told. It didn't make any difference. And when I walk into a store, or walk into a restaurant, I know how hard my staff work. I know how hard my managers work. If I see something wrong, I rarely say anything because it's just a moment in time. 10 minutes from now, it'll be fixed. But there's one thing I always mention. If somebody didn't look good, if they didn't have a uniform on right, and they weren't acting as an ambassador to the company, I said something to the manager. So the manager knew when I walked in that if somebody's uniform didn't look good, there was going to be a problem. Well, what happened was some of these young lads were looking at Adrian and looking at how good Adrian looked. And the comments from the customers about how Adrian's uniform looked great. So I don't know if it was subconscious or not, but these boys started to iron their pants. They didn't forget pieces of their uniform. And they started to come to work with a little bit more pride in their appearance. I couldn't do that. My manager couldn't do that. Adrian did it. So here's someone with a very, very significant disability, bringing something of immense value to my business. Now, what I've shared with you today is basically business, dollars and cents, business case. And when you leave this webinar today, that's what I want you to focus on. I'm going to give you a piece of data when I'm finished speaking here, which will be the one piece of data I want you to take home with you, back to your agencies or back to your businesses. And I want you to continue to focus on that last piece of information I'm going to give you. But before you do that, I want to bring you back to Clint, because there's a human side to this. Now, Clint is still working in the Tim Hortons that we sold. He's been there for more than 25 years. He'll be turning 50, I think, in 2 years, so he's in his 48th year now. He has slowed down. He now has to take naps during his shift. So the way we fixed that was by changing the manager's chair to a flat chair. So when the manager's using it, it's a regular chair. When Clint's using it, he can go to sleep. And that was an easy and low-cost accommodation to make for Clint, to make sure that he could continue his job. Clint was sort of a trailblazer. He was one of the first people with Down syndrome in Canada to get a long-term permanent job. The Down Syndrome Associations gave him many awards back in the day. And he's also been featured in videos. Been interviewed by some newspapers and TV. There's a 1 hour feature-length documentary on his life made by Rogers TV. You can find it on YouTube. And he's led a stellar life, a full life. You know, got married, lives in his own condo, living a full life because he has a paycheck, contributing to taxes, contributing to CPP, doing all the things that we hope for ourselves and we hope for our children. He calls himself Captain Hollywood now, and he's not the dining room attendant. He promoted himself actually years ago. He's the dining room manager now. So he's a comedian, very funny man. Confidence level is high, and he's just a lovely person to be around. Very hard worker. A few years ago, I do a lot of presentations like this, but a few years ago, I was asked to do a presentation to a group of families who had young children with significant intellectual disabilities. And I turned it down. That's not my forte. What was I going to say? That it sucks out there? Because it does. They insisted. So I thought, how am I going to do this? It's one thing to talk to employers. It's one thing to talk to agencies. But to talk to parents with young children, especially with the young children in attendance, I wasn't sure how I was going to do this. So I came up with the idea of bringing Clint with me. And so I said to him, Clint, how would you like to do this? There'll be families there, probably about 45 people. And maybe you talk about your job. Talk about what it means to you. What does the paycheck mean to you? He said, I'd love to do that. So we did. We sat at a little table at the front of the room, and the families came in. And I had to prompt Clint to ask him the questions and give him a little bit of a leading answer for some of it. But he did very well. And the families went home feeling a little bit of hope that when their children grew up, that they too would have an opportunity to work like Clint, an opportunity to live a full life like Clint. We were asked to do it again, and again, and again. And so we did this about 4 or 5 times. And each time we did it, Clint got cockier, he got more confident, to the point where when we did the 5th one, I didn't get a word in. He spent the whole 45 minutes talking about his job, making fun of me, talking about the fact that I don't work at all. He was in his glory. He was just having a great moment. Sometime after that, we received an email from the government of Canada asking if Clint and I would travel to Ottawa and sit before the Standing Committee on Developmentally Challenged Children. So I said to Clint, this is very different. You're going to be in Parliament Hill. There are going to be all these very important people. I said there'll be a lot more than 45 people. I said there'll be TV cameras there. I said, would you like to do this? He said, I'd love to do it. Okay, so we traveled to Ottawa. We went into a room with a U-shaped table with 15 seats. And Clint and I were sitting at a small table at the front. And we were the first ones there. And behind the speaker's chair, there's a whole bank of TV cameras, C-SPAN, Rogers, Shaw, Global, all of them were there, and all sorts of radio stations. And slowly, everybody entered the room. There was 15 MPs from 3 different parties who were part of this committee. And there was huge hubbub in the room, because there were probably about 150 people in the room, everybody talking. And I look over at Clint, and he's white as a sheet, and he hasn't said anything. And I think to myself, okay, this has gone too far, and that's okay. I'm going to have to do most of the tracking today. In front of each panelist and committee member was a microphone with a red button. The chair called for quiet, and slowly the hubbub went down. The lights on all the cameras in the background went on, and at one point, there was absolute silence. And Clint presses the button on his microphone, looks at me, and he says, would now be a good time to ask for a raise. It was the first time in many years, all three parties were laughing at the same joke. It's profound. Yes, it's funny. No, he didn't get a raise because he got one before he went up to Ottawa. But here's someone who on the spectrum of Down syndrome is below the 50th percentile, had the confidence and the timing to be able to make that comment. Not only did he come up with something funny to say, he knew that it would be funny for the audience, but to get the timing right. And half of us on this webinar couldn't do that today. It was amazing. In closing, I want to leave you with one last piece of data. Now, this data is changing because the government of Canada is actually changing the percentage of people in Canada who have disability. When I started talking about this back in 2005, the rate of disability in Canada was 15.5%. It's now between 22 and 24%. We need to narrow that down to an exact amount. We need to know how many people in Canada actually have a disability. So between 22 and 24% right now. Some of you, especially in business, will say to yourself, that number is not so high that I have to worry about it. I don't see people with disabilities coming into my business. I don't see people in wheelchairs coming into my restaurants. That doesn't mean that you can ignore that demographic. Because if you take the 22% of Canadians who have a disability and you add in mom, dad, brother, sister, son, daughter, you are now at 70% of the Canadian population. So 70% of the Canadian population either have a disability or have a loved one at home who have a disability. And that's a number none of us could afford to ignore. When I was in my business in the last year, I had 6 Tim Hortons restaurants. I'd sold some of the restaurants years before, but when I finished, I had 6. In those 6 restaurants, I had 14,000 customers a day. That means around 9,500 customers per day. Disability was front of mind. And again, that's a number none of us can ever afford to ignore. So thank you very much, everyone, for having me here today. It's been a pleasure to present to you. And I'd like to move over now to questions.
Thanks, Mark. Really appreciate everything you said and all the wisdom that you bring. I would love to have you out in Nova Scotia and I can go talk to employers with you and just let you do all the talking. Because I think what you have to say really does have an impact on the business community.
Definitely.
And, you know, as service providers, it's great that, you know, we get to go out and talk to employers, but the impact that a business person has in talking to another business person is a lot greater than a service provider. So having allies like you, being able to go out and talk to employers and service providers is a great thing for us. So we really appreciate your words today. So yes, questions. Please put in your questions either in the chat box or the question and answer. And Mark, can you see the questions that come up?
Yes, I can.
Okay, good.
So Kim actually just had a nice comment. She said, I had goosebumps, tears, and laughs while Mark was talking. Such an amazing presentation.
That's good to know, because Mark, it must be a lot different for you. You're used to being in front of a crowd, where you can see the crowd and hear their laughter and kind of get a feel from the audience. This is much different, where you're not seeing the. That's nice feedback. Thank you for that, Kim.
Yeah, Marcus, it is very different. I'll be honest with you, Zoom and Skype is not the friend of people who are deaf.
Yeah.
So it is very difficult to present in this way. But speakers do feed off the audience. Usually when you crack a joke and you get a laugh, it sort of helps you go to the next part of the presentation. And that's missing when we do Zoom presentation.
Totally.
But having said that, this is how we stay safe.
Yeah.
And those days will come back.
Yep.
Definitely.
Yep. There is a question in the question answer from Wendy.
She said, what types of training or learning can the business community access to be prepared to have an inclusive space in Nova Scotia? Is there a standard package or is it individualized?
Okay, so from my perspective, it can be both. It depends on the individual. Marcus could certainly answer that question much better than I can in terms of what supports and training are available. When it comes to training with people with disabilities, most of them would simply go through the same training that any other employee would do. If a person is in a wheelchair, if a person is deaf, there should not be any change in training. Online training is captioned for people who are deaf. The online training has software packages for software programs for people who are, have lost vision. And so those types of small accommodations should already be there for those people with those types of disabilities. Where it becomes really significant in terms of training is when the potential candidate, the potential employee has an intellectual disability. That's where they're going to need the bulk of the help. Someone got Down syndrome like Clint, or someone who has autism, where you're going to have to provide pre-employment training. And this, it's important to remember that the most important training is a training they get from the employer, not from an agency. So when agencies have training programs, which typically would start off with how to present yourself at a place of employment, how to dress, how to get through an interview, how to maybe even write a CV. Those types of things are important, but they're not nearly as important as on-the-job training. So you want to keep the training programs by agencies short. I'm seeing training programs in Ontario that are 29 weeks. That's a waste of time. The maximum should be 6 weeks. You don't want to go much past 6 weeks. There's not much more that an individual can learn after 6 weeks that will not be taught in the workplace. What's important here is making sure you've made the right fit, that the agency that is representing the individual who has a disability is following the business case. It's following what's been written in the Baker's Dozen, in that they're making sure that the individual, first of all, wants to work in the job that's been presented to them, that they're capable of being in that job, that they're comfortable with it, and that they've got the supports from the agency and from the employer themselves.
Lots of great comments coming in the chat box as well as the Q&A. A lot of people are saying they really enjoyed your presentation. Some are saying, you know, I wish I could have you come speak to all of my employers in my area. So lots of really great comments. Another one, you've made a compelling case to make sure this topic is discussed in business classes in university and colleges. That's really cool. I agree with that.
Yeah.
I identify as a hard of hearing person, and you are very inspiring. I hope more employers will be inspired by you. So some questions here as well. So Leslie asked, do you feel that when you have conversations with employers that you find they respond more to your personal experience as a business owner in comparison to just the statistics around hiring folks with disabilities?
So I think that's a really good question, Leslie. The only way to get the statistics and the experiences across to other employers is peer-to-peer. You know, you're going to have some success if you're an agency worker. You're going to have some success with business if you're approaching business by yourself, but you're not going to have significant success. This is what we call business champions. So I'm a business champion for Marcus. So if Marcus has a person who wants to work at Tim Hortons and he doesn't know anybody in town who's operating at Tim Hortons, he can call me. I call the person at Tim Hortons and we speak peer to peer because we speak the same language. And this is scalable. A few years ago, I sat across from the CEO of General Motors Canada. We had a conversation about the things that kept us up at night. It was exactly the same thing, just on a hugely different scale. So it's good. It's a good question, but you have to use the business leaders in town to help agencies with success.
Absolutely. Thanks, Mark. Kenza also had a question. Ooh.
So there's a question that's come up here. I want to just verify a comment I made at the beginning about eugenics. The stories that we're hearing around those who have been turned away from ERs and have been placed into LTC across the country is in the United States. We have heard some stories in Alberta where policies were written to prevent, in triage, care to people with significant disabilities if there was a situation where there was a shortage of ventilators. This is a decision that a doctor has to make, a very tough decision. Unfortunately, those were made public. But Canada is not the United States. Just devastating what's happening in that country. So thank you for that, because I wanted to clarify that it is in the United States where they were having that issue.
I have a question, Mark. I think we had a question a little bit earlier about, you know, a package or something for employers, and there is some stuff out there. I would suggest the baker's dozen that you have put together is a good thing for people to review. The Canadian Association for Supportive Employment case is putting together an employer toolkit as we speak, which should be ready sometime in the fall that can be used. But I think often the challenge is they're often very broad, and it's hard to use them practically for employers. And it really comes down to that relationship between the service providers and employers and the work that they do together. Each person that works is different, and each job is a little bit different. And I'm wondering, Mark, if you had a few comments about how you worked with service providers. I know you mentioned you had job coaches come in, and I've heard you say in the past that those job coaches have to learn the job first before they provide support to a new employee. But Could you talk a little bit about that relationship between employers and service providers and how you utilized the services in your area?
Yes, it's a very important topic, Marcus. The agencies are the experts. I'm not the expert. I'm an expert on donuts and coffee and retail service. I'm not an expert when it comes to people who are disabled, even though after all these years, quite the knowledge. When we started off with agencies, we kept in touch with them. And later we found that that was probably one of the smartest things we did, is to have a lifelong relationship with the agencies and the job developers, because sometimes there can be issues related to the disability that we don't know how to handle as an employer. For example, if there's a behavioral change in someone with an intellectual disability, are they just not interested in the job anymore? Or is there something more serious, like a medical condition? And so we weren't experts in that. And we did have a couple of cases, one serious, where a person actually had a brain tumor and had completely, their behavior had completely changed. And we didn't know what it was. So having that ongoing relationship with the job developer and with the agency, we were able to make a phone call and say, we need your help, come in, what's happening here? And long story made short, that particular individual is today back at work and living the life she was living before. That wouldn't have happened if we hadn't had that relationship with the agencies. Also, I look at a service agency as an extension of my HR department. So when I'm actively looking for new employees, you know, I have an advertisement out there for a baker, or I have, you know, an advertisement that I'm looking for someone to work on the front counter in my Tim Hortons. I would often call a couple of the agencies I'm close to and say, hey, just so you know, I've got this job ad out there. Do you have somebody who you think might fit this position? One of the things that I do with agencies, which is can be quite interesting, if Marcus comes to me and he says, I've got the perfect person for you to bake in your kitchen, my first question to Marcus is, what do you know about baking in Tim Hortons? And of course, Marcus has never baked in a Tim Hortons, but now he's going to do a 3-hour shift. And that way he's going to know for sure whether the person he has chosen for that job is the right person for this shift. Okay. So, you know, the relationship with the agencies has to be ongoing.
Well, thanks for that, Mark. And I would have loved to do that as long as I got a couple of apple fritters at the end of it. I think MJ has a question. Is that true? Yeah.
Sorry, the interpreter didn't have his mic on. Hi there, Mark. Good to see you again. Long time no see. I think the stories you've been telling are fantastic. Some of them have given me chills. As a deaf person, I rely on sign language in my day-to-day life as well. And working with Marcus and everyone at Teamworks, I'm so grateful. And I have the ability to do my job and be recognized for my contributions. And similar to Mark, I've gone around to some employers to try to and give presentations to try to educate them on deaf and hard of hearing culture and give them some tidbits as to how to exactly work with these individuals in their employment setting and try to get more people with disabilities involved. And it's been a great journey. But my question for you, Mark, is I know now with COVID and everything that's going on and with masks and PPE and more barriers being put in place due to COVID, I've already had some challenges due to some of the PPE requirements. When you get people who are maybe a little defiant about wearing a mask or anything that has to do with COVID. How have you been treating those situations? And do you have any tidbits for employers who may be going through that similar situation, who may be struggling with people who don't want to wear their PPE?
Well, that's a great question.
Questions actually,
My
when people are wearing the masks and you're hard of hearing, how do you deal with that challenge?
the issue of masks has been a game changer for me. I was in a grocery store this morning before I came to this office, and I was asked a bunch of questions by the cashier, and I have no idea what she's saying. When I said to her, I'm deaf, I have to lip read, she just kept talking to me through the. So I don't know if she was telling me that I'd won $10 million or get the hell out of the store and don't come back. I have no idea what she was saying to me. So it's very frustrating. I don't know what the answer is yet. We have found clear masks to be a solution. Unfortunately, they're expensive. And we did a test at the Canadian Hearing Society, and they are not sanitary. What I would like to see, and one of the things that I've suggested to local stores, is that they wear a shield and a mask under it. And when somebody who's deaf comes in and indicates that they're deaf, the worker can remove the mask and still have the shield in front of them. That's safe. Shields are very inexpensive. They're only around $2.50 here in Ontario. And so that is one way to solve that problem. But there's a level of frustration right now in the deaf community. It's a good thing I'm not a violent person, because I would have killed somebody by now, because it's just so frustrating having to deal with retailers and, you know, like, but anyway, that's another story. But speaking of COVID, we're going to see a sort of a new landscape as we come out of COVID. There's an unknown. We don't know if we're going to have a second wave. We don't know how serious the second wave is going to be. We don't know when government's going to run out of money. We don't know how impactful this is going to be on our economy. We're already seeing signs of government asking agencies to return money and try to save money after being promised money. That is usually the first step to significant austerity measures. So what does that look like for people across the country with disabilities who are trying to find work? We've got 20 years of excellent improvements. You know, the unemployment rate hasn't moved, and that's because so many more people are becoming disabled, but the participation rate is improving, and we can't go backwards. So what I think is going to happen is they're going to find that those who can work at home, people who are in wheelchairs, people who are deaf or blind, or other types of disabilities, episodic disabilities, for example, who can now work at home. Employers said up to now, you can't work at home. We can't do this job at home. Well, COVID-19 proved them wrong. So many jobs can be done at home that they didn't think could be done before. So that opens the doors to people with disabilities. Instead of a corporation or a company or an office spending, you know, smart ones, in some cases, some money on accommodations, but mostly small accommodations, getting around that mindset that accommodation costs a lot of money, having that person work from home.
Yeah.
Now you can hire people from around the world.
Mm-hmm.
If you want to hire the best person in a particular position, you can hire them from South Africa. It doesn't matter if they're working from home, right? And so disabilities now become less of a burden, so-called burden, to employers when they're hiring. But that doesn't help those with intellectual disabilities. They don't work from home. They don't want to do the entry-level jobs in restaurants. 80% of people with an intellectual disability who are working in Canada are working in retail, with 60% of those, I'm sorry, switch this around. 60% are in retail, with 80% of those working in quick service restaurants. Well, with quick service restaurants closed or opening partially, probably for the rest of this year, those jobs will be eliminated. So we have to double our efforts for those with intellectual disabilities and find them jobs in other places, such as the example I gave earlier, which was in food manufacturing. And the bonus to that is that those jobs pay better.
Mm-hmm.
Awesome.
Thanks, Mark. We had another question as well. Sienna asked, how do you address concerns or judgments from coworkers who become insecure with their own position in the organization when a person with a disability is able to do the same job as good or even better in some cases than a person who is able-bodied?
So to confirm, you're asking if a person who is so-called typically abled is working with someone who's disabled, and their discomfort?
Yes. In some cases, maybe, you know, the individual with the disability gets hired and they end up doing a better job. So then the other employee might give a bit of judgment or concern about their job security.
Yes, well, okay, this is a concern. In my experience, it hasn't happened very much. When you hire people with disabilities, you slowly change the culture of your workplace. In fact, it's one of the most important things that happens in a workplace is when people are included from various demographics, is you change the culture of your workplace. That creates a level of comfort in terms of being around people with disabilities. There are many Canadians who have never spoken to a disabled person. And now all of a sudden you're working with one. What do you say? How about hi or hello, Mary? They don't really typically feel that. I did a presentation at the University of Toronto last year, and these were graduating students. And there was one student who was sitting at the back who I could tell wasn't paying attention. And afterwards, when I was leaving, he caught up with me and he says, listen, I want to thank you for the presentation. He says, I'm one of those people that if I saw a disabled person walking towards me, I would cross the street because I didn't want to catch what he had. And so that's a level of misunderstanding, misguided thinking that's still out there with general population. And so in the workplace, you can run into that. We had an issue years and years ago with Clint, where I had a manager in the store Clint was working in, and we had received a health visit. Now, a health visit in the city of Toronto back in the mid-90s was a very, very difficult thing to pass. And it was very nerve-wracking for myself and for my manager. And of course, as the investigator was walking around the restaurant taking notes, Clint's following him close behind, looking to see what he's doing. And we passed. And everybody was relieved that we passed. But Clint says to the inspector, well, you wouldn't let us pass if you saw the freezer on the outside of the building. Well, the inspector, he chuckled. But afterwards, the manager took me into the office and he says, I can't do this anymore. He says, you have to make a decision, Clint or me. I said, well, that's easy. He's my best employee. You can go. And so what that did is it showed the rest of the employees, hey, Mark's serious. Mark's serious about inclusion. He's serious about including people with disabilities in these jobs. And so that's how you start to change the culture in the workplace. And we had employees, there's another statistic that's interesting. Our turnover rate was under 40% across the board. The 46 with disabilities in the last year didn't leave, so they're at 0. But the 200 who didn't have a disability, their turnover rate was 55%. Still half the norm, because people want to be working in an inclusive society. Remember that 70%. 70% of Canadians are directly affected by a disability. So to answer your question, rarely happens.
Thank you, Mark.
I think there's a question from Leslie there too. Do you see that, Ashley? I can read it.
Okay, yeah, I don't see that one.
Or maybe we answered it. Who knows? Do you feel that when you have conversations with employers that you find they respond more to your personal experience as a business owner in comparison to just the statistics around hiring folks with disabilities? And that's a common thing when we go out. You know, do we talk about the stories or the stats? You know, they both have an impact, but what's your take on that when you talk to employers?
Leslie said we did cover this.
Yeah, they're both important.
Yeah.
The statistics are not anecdotal, so they're very important. My experiences as a business owner is what opens the door.
Right.
But when I sit down with an employer, I can't just say, "Oh, it's great for my business. You know, we did this, we did that. It's changed lives and all that." Business owners don't care. You know what keeps me awake at night? I had a $3.5 million payroll. I had to make sure that my sales and my profitability was high enough to be able to make sure that I could complete my payroll.
Mm-hmm.
These are the kind of things that business owners are thinking about. If you say to a business owner at 3 o'clock in the afternoon, "Have you made enough money today?" What are they going to say?
Mm-hmm.
They're not going to say, "Yes, I've made enough money today. Thank you very much." They're going to say, "Can you please tell me what you're talking about?" Right? And so the statistics are extremely important because they're real. When I say to an employer, I can help you cut your turnover rate in half, that employer has probably spent thousands and thousands of dollars in the last year trying to figure out how to cut it by 5%.
Mm-hmm.
Now I'm offering them a way to cut it by 50% without spending any money at all. They're going to roll out the red carpet.
Yeah.
But you have to have those statistics. You have to be able to show evidence in an empirical way. It's not anecdotal. You've got to be able to show employers that this is real. They've got to feel it. They've got to taste it. They've got to understand it. The message coming from me is very important because I was a successful business owner, although I was a small business owner. They want to hear more when I say to them, I made more money than any of the other Tim Hortons franchisees. How did I make more money than the other franchisees? Did I have higher sales? No. Did I have cleaner restaurants? No, I didn't. The only thing I did is I included a demographic of Canadians who are largely ignored.
Okay. I don't think I have any more questions that I can see, Ashley.
Yeah, no, I think that's it.
I think that's it. So I think
One of the things I would like to add, Marcus, is that if anybody on the webinar who wants to see a copy of the Baker's Dozen, just let me know.
Okay.
And maybe I will send out the email to all the people that registered your email so they can contact you. Is that okay?
Yep, that's great.
That's
Okay.
great. And I would encourage everybody that is on the call that if you'd like Mark to present to your communities, to reach out to him as well. He's very accessible.
Mm-hmm.
And he's a really good person. His message is really good for the business community in all your communities, to try to pack the room with as many employers as possible.
Mm-hmm.
But Mark's been doing presentations around Nova Scotia for quite some time in small communities, big communities, and they're always well received. So if you'd like for him to be in your community, reach out to him. And we don't want him getting bored at retirement, so we'll keep him busy. Okay. Thanks a lot, everybody.
Thank you.
All right, thank you.
Thank you, Mark.
Thanks, Mark.
Thank you.
Thanks, Mark. Thanks, MJ.
Thank you, guys. See you.
Yeah, MJ
Bye.
wasn't going to stay at the whole thing. She must have been really into it.
Yeah.
Spoke to her just before, and she was like, "Oh, I don't know if I can stay. I'm too busy. I got work to get done. I'm going on vacation." So she stayed the whole time.
Yeah, that was amazing. That was my first time hearing him speak. It was great. Yeah.
Yeah, he's probably Sean Wiltshire is one of my favorites too. Sean and Mark are two of my favorites.
Mm-hmm.
Just in kind of, the kind of entertainment value and, the message and, their stories and stuff.
Yeah.
I mean, Mark, he's very consistent that those stories are the ones he usually tells.
Mm-hmm.
But if you're in a room with him, it was way different today because you don't have the room reacting.
You don't have the energy in the room. Yeah. I know.
This must be a lot different for him because he usually gets laughing and you get a lot of head shaking and you get a lot of body language and stuff, and he's not getting any of that.
Yeah.
It's really different for him.
Yeah, I know.
I mean, some people, the way they present, you don't get a lot of that, right? But not him. His stories are very impactful.
Yeah. He had me like tearing up with goosebumps at some points too, It's really great.
In their eyes, and he's feeding off all that, right? And too. But it was funny. I still laughed at the same stories I heard before, right? So I saw that he was still cracking jokes and stuff, right? So that was good. It was good.
All right. Well, I'll end the session, and I'll upload this to send off to the editor once it's done.
Yeah, for sure. Yeah, if there's anything you want changed to those videos, just let me know. I think they're fine. I don't know.
I think they're perfect. Yeah, I've been uploading them right to YouTube, so they're ready to go once we're ready to publicize them. Yeah.
Thinking he might for some. I don't know if he did because I didn't go through it. He was saying, if sometimes when they're talking, if it's on the same screen for a long time, that he can put pictures in, kind of drop pictures in, so that kind of back up what the person's saying. I was like, I don't know if it's not, but just to kind of change it up so it's not on the same screen the whole time. Drop in, kind of like in a commercial or a movie, or when someone's talking, it's often it goes off to these kind of B shots, right?
Yeah.
He was doing something like that. I don't know if he ended up doing it or not, but for that.
Interesting.
Yeah.
All right.
Cool.
All right. We'll talk to you later. Bye.
Bye.